Social story on getting the COVID-19 vaccine in communities of color by Chicagoland Disabled People of Color Coalition and Institute on Disability and Human Development. This social story is supported by a COVID-19 vaccination mini grant from the Association of University Centers on Disabilities, or AUCD. Note: this social story is mostly for people of color with disabilities who live in Illinois. However, people with disabilities and allies from any part of the United States can feel free to share the story or take parts of the guide and use it to make their own social stories about the COVID-19 vaccine in their local area. 2020 has been a sad year for many people. One reason why is because of the COVID-19 outbreak that affected a lot of people in the world, including those living in the United States. COVID-19, or the coronavirus, it's like getting the flu, but it's worse than the flu. Some of the signs of having COVID-19 include coughing, shortness of breath, loss of smell or taste, pain, fever, or chills. As of June 21st, almost 600,000 people died from COVID-19 in the United States, according to the of Disease Control, or CDC. Those numbers are continuing to rise. People with disabilities are at higher risk of catching COVID-19. Also, people with also some communities of color are at higher risk of COVID-19. About 42% of COVID-19 related deaths happened among Black people, Native Americans, Latinx people, and other people of color. Fortunately, there are vaccines that can help us fight against COVID-19. It's currently available for everyone over age 12. The FDA has approved Pfizer for everyone aged 12 and older. Moderna and Johnson & Johnson are approved for everyone over the age of 18. Along with social distancing, including staying 6 feet from people, washing hands, and wearing something to cover your nose and mouth, like a mask, COVID-19 vaccines can help lower COVID-19 rates. If people play their role in keeping COVID-19 rates down, we can soon get back to doing things we did before the outbreak, like going to restaurants, watching your favorite band play live, going to festivals, and much more. In fact, many restaurants, schools, movie theaters, bars, clubs, amusement parks, and other places in Illinois will be fully open as of June 11th. You can enjoy the things you used to enjoy with or without a mask. However, we encourage you to get the COVID-19 vaccine if you can. We believe that in the disability community, it's better to be safe than sorry. While some are looking forward to getting the vaccine, others are afraid to get it for many understandable reasons. Some people feel that they will not have access to the vaccine in their local clinics. They may have to go elsewhere for the vaccine, but there is also a possibility that those places don't have the vaccine either. Some feel that they could be discriminated against and prevented from getting the vaccine because of their disability, race, gender, and other differences. Some people are afraid that doctors will use the COVID-19 vaccine to experiment on people of color. Some remember examples of doctors mistreating people of color in the past. For example, African American men in the Tuskegee study between the 1930s and the 1970s were denied health care for syphilis, despite promise despite being promised free health care as a part of the study. Instead, doctors let the men go untreated so they contract the disease. For more information on the Tuskegee experiment and other studies like this one, visit www.news/news/the-infamous-40-year-Tuskegee study. Because the COVID-19 vaccines are new, there's not a lot of data and information on how effective they are in the long term, other than what is reported in trials. There is also not much information on how COVID-19 vaccines impact people of color with disabilities. Because of fear of being experimented on, barriers to getting the vaccine, and lack of information on how the vaccine affects people in communities of color, some people of color with disabilities are not willing to take the vaccine. However, according to data from the state, people of color and Latinx people in Illinois have the highest percentage of COVID-19 positivity cases. If we want everyone to be safe from COVID-19, we must make sure that vaccines, protective gear, and COVID-19 information are available to everyone, including people of color with disabilities. Fortunately, Chicagoland DPOC and the Institute on Disability and Human Development can help you get the tools you need to speak up and speak out on getting the vaccine, regardless of your race, disability, etc. Here are some ways you can learn more about COVID-19 vaccines, get access to COVID-19 vaccines, and encourage your community to get access to COVID-19 vaccines and other resources related to the outbreak. Ask your doctor if you can take the vaccine right now. People with disabilities who are at higher risk for COVID-19 should get their vaccines as soon as possible. If you are looking for a place to get the COVID-19 vaccine, you can go to illinoisvaccine.org and search for available clinics in your area where you can get the vaccine. You can also go to ZocDoc to find places in your local area to get the COVID-19 vaccines. Some cities, such as Chicago, are partnered with ZocDoc. Visit www.zocdoc.com/vaccine for more information. If you live in Chicago, you can also call 312-746-4835. There is a national call center called the Disability Information and Access Line, or DIAL, where people with disabilities can ask for information about where to find vaccines or set up appointments for vaccines. The call center can also refer you to local or state agencies that can help you get the vaccine. You may contact Dial at dial at n4a.org or 888-677-1199, Mondays through Fridays between 8 a.m. and 7 p.m. Central Time for more information, or if you need help with finding a place in your local area to get the COVID-19 vaccine. Clinics cannot stop you from getting the vaccine because of your race, gender, disability, and other aspects of your identity. If you see someone in your clinic who's trying to discriminate against you or people you know, speak up and speak out. If you're unsure about the safety of the COVID-19 vaccine, ask a doctor about its safety. Additionally, look at trustworthy and accurate news sources, articles, and data on the COVID-19 vaccine to learn more about the safety of the vaccine. You can also read or watch stories of people of color and or people with disabilities taking the vaccines. Use those stories to learn about their thoughts on the vaccines. Here are some examples of news sources you can go to for learning more about the COVID-19 vaccines. CNN, BBC, local news, Vice News, Al Jazeera, Politico, Upfront for teens, or the New York Times, Reuters, Associated Press. Some people may be allergic to vaccines because of certain ingredients in the vaccines. If you are not sure what's in the vaccine, ask your doctor or a medical professional who is familiar with vaccines. Tell your doctor about your history of allergies before taking the COVID-19 vaccine. Because there are three types of COVID-19 vaccines, we will go over what's in each of those vaccines. You can also visit the following link to learn more about COVID-19 vaccine ingredients from a link from www.hackensackmeridianhealth.org. If you get the Pfizer BioNTech vaccine, it should have the following things in it: genetic material from COVID-19, salts, lipids such as oils, and sugars. To get fully vaccinated, you will need 2 doses of the Pfizer BioNTech vaccine within 3 to 4 weeks. If you get the Moderna vaccine, it should have the following things in it: genetic material from COVID-19, acetic acid, that's in vinegar, acid stabilizers, those are things that make sure acids are as pure as possible, salts, lipids, such as oils, and sugars. To get fully vaccinated, you need 2 doses of Moderna vaccine within 4 to 5 weeks. If you get the Janssen Pharmaceuticals slash Johnson and Johnson vaccine, it should have the following things in it: genetic material from COVID-19 and adenoviruses, viruses similar to the common cold viruses. Citric acid is in fruits. Preservatives that keeps the vaccine fresh and liquid. Salts, sugars, and ethanol, the same alcohol that's in your beer, wine, and other alcoholic drinks. Unlike the Pfizer and Moderna vaccines, you will only get 1 dose of the Janssen slash Johnson and Johnson vaccine. That is the only dose you will need from that vaccine to be fully vaccinated. Follow the news to find out when vaccines for children under 12 years of age will be available. Some companies are working on making vaccines for children in that age bracket as we speak. Through the Center for Disease Control app called VSafe, you can get frequent check-ins about how you are feeling after getting the vaccine. Sign up at vsafe at cdc.gov. For instructions on how to sign up for VSafe, visit www.cdc.gov/coronavirus slash 2019 dash NCOV slash vaccines slash safety slash vsafe dot html. Ask your clinic, organization, or college to see if you can participate in research or messaging of COVID-19 vaccines for people with disabilities in communities of color. You can help those places spread the word about the vaccines. Encourage your legislators to create laws or make sure that their local area provide access to vaccines to people with disabilities in communities of color by writing to your legislators or talking to them in person or through video chat. Share your story about getting the vaccine. You can use YouTube, a blog, or any type of social media to tell people about the vaccine. Telling your story can help people feel more comfortable getting the vaccine. Some people may not be able to get the COVID-19 vaccines because they don't have access to transportation, or they may not be able to leave the house because of disability, older age, or illness. But no worries. If you don't have access to transportation, you can still get the vaccine. There are 4 ways you can get it if you are in these situations. Until December 31st, 2021, the National Council on Aging is partnering with rideshare company Lyft to help people ages 55 and older go to clinics and participating pharmacies to get the COVID-19 vaccines. You can use a code to get a free or discounted ride to and from the place where you're getting the COVID-19 vaccine shots. For more information, visit the link from www.ncoa.org. Uber will offer codes that will cover rides to and from your local Walgreens for your COVID-19 vaccine appointment. Uber can cover up to $25. The promo lasts until July the 4th. The code is effective each day from 6 a.m. to 8 p.m. Visit the following link for more information: www.uber.com/newsroom/free vaccine rides. If you are in an area where you don't have access to the COVID-19 vaccine, or you're not able to leave your home due to a medical condition, that is okay. Ask places in your local area to see if they offer mobile vaccination where people can come to you and give you the vaccine. Pharmacies like Walgreens may also have those services. For instance, you can ask for mobile vaccination in Chicago. For more information, go to the following link from www.chicago.gov. Depending on your local area, there are some perks you can take advantage of when you get fully vaccinated in Illinois. If you're fully vaccinated, meaning getting all the doses after 2 weeks, then you don't have to wear a mask to do the things you enjoy, like going to the park, travel, swim, or hang out with friends. However, you will still have to wear a covering for your nose and mouth in certain places, like public transportation, some grocery stores, and some restaurants. Visit the CDC webpage for more information about what you can do after vaccination. The link is from www.cdc.gov. You can show proof that you're vaccinated in certain events in your local area if the event host asks for it, or if you state while getting tickets that you're vaccinated. You can either show your vaccination record card that you got from your clinic, or you can also show screenshots or copies of medical records that state you've gotten all your COVID-19 vaccine shots. Unless the venue requires it, you don't have to wear a mask at an event if you're vaccinated. Six Flags Great America locations in Gurnee and Rockford are giving out tickets to those who are newly vaccinated. You can get tickets from your local clinic or organization who gives COVID-19 vaccinations. For more information, check out your local clinic or visit these following links. More examples of perks for getting the COVID-19 vaccine: access to concerts in your area. Your job may give you a bonus for getting the vaccine. Some professional sports teams, like the Chicago White Sox or Chicago Fire, may have promotions where you'll get discounted or free tickets. Check your local team for details. Discounts or freebies at some local or national stores or restaurants. discounts or free entrance to certain museums and zoos, like the Lincoln Museum in Springfield. Always ask local places, follow the news, or ask someone you know for more details. Thank you for your support and patience with going through the guide. It was a lot to cover. We hope that by checking out our social story, you'll have the information needed to get the vaccine and encourage more people of color with disabilities in Illinois to get those vaccines. Here are some additional resources related to COVID 19 or the COVID 19 vaccines. Some are in plain language, and others are available in multiple languages besides English.